these pregnant women, they can actually support each other, go to the 9 months of pregnancy, learning and co-sharing the experience of all the things that they learned from the workshop. Okay? So rather than you, especially for first-time moms, normally they get their support, of course, from the family members. But sometimes those information are quite outdated already. So the outcomes there, we will be monitoring. This program is nothing unique of Delgado. This has been done in the United States. Similar to our country, there's also an increasing number of premature deaths, of course, autism and other behavioral disorders affecting pregnancy. So this was done already, and they've actually monitored the outcome of participants for this workshop. So the baby's length, the birth weight, because when a pregnancy is small for gestational age, or when a pregnancy is delivered prematurely, that is actually a sign that that pregnancy is definitely not optimal, and it doesn't end there when the baby is delivered. The impact of that on her pregnancy continues, most especially during the first 2 years of the life of the child, and even later on long term. Okay? So, in our country, the sad thing is that obstetrics practice is like a conveyor belt. Parang next, and it's actually delivered in two forms. Either you go to a big hospital like the one near us, so it's high value, you spend so much, or you go through or deliver in a government hospital or in a line-in clinic. Okay, you pay less, but the outcome is the same, right? You see premature deliveries in big hospitals or modern hospitals, but you also see premature deliveries or premature death in line-in clinics or in government hospitals as well. The outcomes are the same. The outcomes are just expected as they come. We want to change that expectations. By changing the expectations, so these are the list of expectations. For those of you who have been pregnant, I have 5 kids of my own, so this is just, even to the father, I think this is the expectation. Dispel the fear and anxiety of pregnancy, that's for the woman. Gain knowledge of what has to be done, especially for a first-time mom, di ba? Gusto mo, anong gagawin mo, some are not ready, becoming mothers, emotionally, physically, psychologically. So, or to have no complications, of course. Every one of us, both the mother, the father, the grandparents, would want to be able to have a healthy child. So these are the expectations. For this Delgado Clinic's Optimal Birth Outcome Workshop, we want to include these additional expectations. To have an extra security net against obstetric complications, as I mentioned. There's also an increasing number of gestational diabetes, which later on lead to increasing pregnancy-related deaths among mothers. We also want to have a well child who can age optimally into their adult years, and as well as to have optimal return to function or postpartum. So even postpartum depression, that's nutrition-related. Okay, so this is what we want to provide as a unique reason why we would want women, why we want to become champions of mother care. So these are the list of services provided in any hospitals. So prenatal consults or visits, vaccinations, supplementations, diagnostic tests like ultrasound, labor care, prenatal, post-labor care, and pediatric care. These are just the usual. But for Delgado, what we want to provide as an additional list of services is to give our patients nutrition education for optimal pregnancy and healthy pregnancy. Stress management, of course, nowadays, women are no longer in their houses. A lot of women are career women, career mothers. So we want to help them because stress impacts as well that growing fetus inside the pregnant woman. So exercise and movement is not contraindicated to pregnant patients, except, of course, if they have pregnancy-related conditions like hypertension, diabetes, all these things. Group sharing and support. So like I said, we want to provide our clients this group pregnancy concept with social media and networking nowadays. So we want to make this as well as an add-on services to our patients and clients. sleep classes or optimal child program or centering on parenting, especially for the first 2 years. Of course, to our children, very important din ang optimal nutrition. So these are what's in store for our clients who will be choosing to partner with us with regard to their pregnancy. Next. So instead of just offering maternal health care based on packages, high-value packages like in big modern hospitals or low-value packages like in clinics, what we want to provide are value-based maternity package. So we're in the price together with all of the other things, and more than that, this particular program or packages or services for mothers is focused on prevention and optimal growth and development well into the adult years. So we want to change the expectation of mothers and fathers, and of course even the grandparents. And we want to provide higher value-based maternal care. Okay? And to that, we can elevate the outcomes. We can reduce the 368,000 preterm births happening among Filipinos. Some of them don't make it. Others were fortunate enough to have amazing doctors and nurses who have stayed on with them to that very difficult journey. We'll be showing you later on one story, a Delgado story of this difficult beginning. So with that, also we're changing our facilities. This morning, together with this event, we inaugurated our new ultrasound. One of the latest to be able to equip us in providing this modern mother care. And there will be some changes even in our look. So our nurse station will soon be renovated. We really want, what Delgado wants to happen is for us to design and create a health services that is designed for women. A healthcare services that works for women. That's what we want to become in the next 5 years. We're starting with obstetrics, with mother care. So we are aiming to become champions of mother care for this year, over the next 2 years, and later on we will become champions of women's health. And then afterwards, hopefully, we become champions of healthcare. Okay? So we're also changing our facilities, our look, and as well as our facade sooner or later. So we're starting with outside, and sooner or later within this years, you'll be seeing a different look, facade, and even services of Delgado Clinic. So we're using the term Delgado Clinic because this hospital has been around for 70 years. So we have a lot of stories of, like I said, of premature births. We have a lot of multi-generational mothers. We have here mula sa lola hanggang sa anak, hanggang sa apo, at yung apo sa tuhod, dito pa rin nanganganak. So that's why we can proudly claim that we are indeed the champions of mother care because we've been doing it for the past 7 years. This year is our 70th anniversary. So 7 decades of providing and championing the vision of our founder, Dr. Jesus Delgado, the true champion of mother care since 1948. Alam niyo po, itong hospital na to, nagsimula ito isang maliit na klinika na tinayo ni Dr. Delgado immediately after post-war. So even during the time, we already had that vision. So we really need your support and in propagating, in helping us change the expectations of mothers so that we can also change the outcome. So with that, I'd like to thank again each and every one of you for coming and for supporting this activity. Thank you very much.